Welcome to our October special. This month is Breast Cancer Awareness Month. It's a very special month to the ladies, actually to some of men too even. And we thought, we people at Women of Courage Asia would really like to do a shout out this month for breast cancer awareness. Particularly so also because of our uh, dear guest speaker today as well. She's a very crucial part and integral part of Women Courage Asia. And if you don't already know Anita, Anita is always our fabulous MC at the monthly Empower meeting. And she shared her story at our third anniversary, her very touching and very moving story. And if you missed it, you missed a lot. But this time we invite her back to share a little bit more in depth of what she's been through as a breast cancer patient currently. We'll go through her story. I'll let her share. But to those who are new with us, I'll let Anita do a introduction of herself.
Okay, hi, I'm Anita. I'm from Singapore, but currently in the UK. Not for holiday, just to settle my daughter down. So I'm in this beautiful land called Cambridge, and it's so beautiful. You should see the videos. Anyway, I am a volunteer with Women of Courage Asia. I'm also a mom of three beautiful teenagers, young adults now. So yeah, basically I am still undergoing cancer treatment. Yeah, I'm still undergoing cancer treatment. So I hope to graduate in January 2023.
We are all rooting for you here in Women of Courage Asia, of course. And Anita has been so brave about it all, and that's why we really wanted her to come in and share her insights. Even as she's going through this journey, what are some of the things that she can share with the viewers out there, even for especially for women at this age. We really need to be more aware about our breasts and how we can really take good care of them, and prepare ourselves so that we can look out for signs and things like that, right? Anita, I know this is probably a very sensitive topic and to you right now, but so can you share with us a little bit, like what was it like? Okay, what was your idea about breast cancer awareness before you even had it? What do you think about it then?
Well, to be very honest, I didn't think anything about it. I couldn't be bothered, actually, to be very frank, thinking that it'll never happen to me, because I got no family history. I think I kind of take care of myself, but it is a silent. It creeps in. It doesn't matter if you have no family history. So if you don't go for early diagnosis, you don't go for your mammogram or even your self-examination after the shower, uh, it creeps in. So yeah, so basically negligence is what I was going through. I couldn't be bothered. That's the frank answer.
I'm sure not just you. I think many of us fall into that category. I mean, I probably wouldn't have done it if not for the fact my company sends me for regular checkup. But that said, so how was it like? What was it that led to your discovery that you had breast cancer? How did it happen?
It happened because I decided I was 85 kilos. I was a bit overweight, so I decided one day to find my sports bra and squeeze my breast into a sports bra that was like 10 years old, something like that. I was way thinner then. After exercising, then I went to my laptop to work, and that's because when you squeeze everything in, something will pop out. So the side of my right breast, there was if you see the breast, it's just a whole thing that pops out. So it's very significant. So when I felt it, I went, I think you just know that it's not good news as a woman. I think we have the intuitive, and I knew this is bad news. So I didn't cry. I didn't ask why. I think I was very calm and logical. So immediately went to see the doctor to get the usual mammogram, get the biopsy done. And within a week, I won the 4D lotto ticket, stage 2, triple negative.
So to some of us that are very, very new to breast cancer, maybe we can have a little bit of an infographics to kind of help us out here. Let me share a screen with those ladies that are tuning in. We are not experts on this, but there are a few stages of cancer that we can see here, from even stage 0 to stage 4. What we can say, that's mainly determined by the tumor size. So from very small ones in the glands, 2 cm, 2 to 5 cm, or 5 cm and larger. So anything, those kind of thing will determine which stage you will be at. Of course, also whether your lymph node are affected, and whether is it confined to the breast area or has it already spread. That will actually largely determine how, the breast cancer stage is, yeah. But I was really amazed when I saw this, doing my research, and I saw this infographic that the 5-year survival rate is very high. Yeah. So, I don't know, maybe Anita, because we never went to even bother to check ourselves, right? When your doctor probably walked you through this graph, if he ever did he?
The doctor didn't need to go through it, but every breast cancer patient will get what they call a breast cancer nurse that you can call anytime for support. And she did this infographics to explain to layman's term. And if I may say so, if you need to get cancer, I mean, I don't preach this, but if you need to get cancer, breast cancer is one of the best cancer to get, because the survival rate, as you can see, even at stage 2, is 87%. So, and the diagnosis and the treatment is so good and advanced that you don't have to fear much, besides side effect. I can see my hair just started growing. So, I'm waiting for a nice long hair soon.
and and it's gonna grow out even more luscious than before, I'm sure. So yeah, so ladies, I think this is a big encouragement to all of us to really, really do our checks early, because the earlier you catch it, the higher the success rate of you recovering from it and even going out from the remission stage of the 5 years stage. Yeah. So call out number 1, do your checks early. Right. But so next, Anita, so you did share with us, that you didn't really, like it wasn't all doom and gloom the moment. I mean, you had the science check that it was like, oh, it's probably going to be breast cancer. What was the thing that gave you strength? I mean, I've heard that treatments and whatnots can be really grueling. The nauseousness and the lack of energy and whatnot. What's the thing that really, really, pulled you through this whole many, many months of cancer treatment? You're on mute, dear.
Okay, maybe you want to put out the infographics and then we can speak.
Oh, sure. One
Yeah.
second.
Too sexy. The picture is too sexy. Basically, first of all, I think you need to have faith. I'm not talking about spiritual faith, but spiritual faith is important if you're a spiritual person. But I think first of all, you need to accept that, okay, you have cancer, because until you come to that point that you cannot, if you're still in denial that that you don't have it, or maybe you want to go for alternative treatment or some herbal treatment or something like that, until you have to accept the fact that you. And then the second thing you need to do is not to think that it is a death sentence. It is not a death sentence. As you can see, I had stage 2 and I had an 87% survival rate. I mean, so these are the two things. And then the third thing actually for me is having a very positive mindset to know that I'm going to get the best possible treatment. I'm going to get the best possible care. And I went to the public hospital. I didn't go to private. I went to public hospital, and honestly, I got the best possible care. And having that faith in your support system, you know, your medical treatment, your doctors and your medical treatment. And also I had a very small group, maybe 2 or 3 people, which I know I can call up anytime and go, I'm feeling crappy. So that support system is very important. And you got to know, when you're a cancer patient, your family, like I have 3 wonderful daughters, I have a husband, you cannot burden them because they already feel very burdened and they don't know how to help you. I mean, you only know what your symptoms are and how crappy you feel. And I keep using the word crappy because you do feel crappy, especially if you take on IV chemo. Okay, so basically having that positive mindset is so important. The self-talk, to wake up in the morning and go, I can do this, and having a list of things to do, meaningful things to do. Like for example, I refuse to get help. Okay, maybe I'm just psycho. Okay, I refuse to get home help, meaning like a part-time maid or something. So for me, it forced me to move. Doesn't matter if I sweep half the floor. It forces me to move because I remember there are days I only do like 500 steps. And 500 steps, just wake up, go to the toilet, and come back. When I used to do 10,000 steps a day, right? So having these three things, having faith in your ecosystem is very important. Having faith in your ecosystem and creating a positive ecosystem, that for me was what's pulling me through. I mean, I'm still on chemo. I finished my 16 rounds of chemotherapy. Now I'm on 6 months of IV tablets because they still found tumors. And just accept that this is what you have to do. It's just a year. It's just a year. Then I graduate in January. Then I live life. So it is really not. I'm not putting it down because I know there are other people listening who has gone through cancer, but I was one of the few fortunate ones that never had much of a side effect like the nausea. I never had nausea. I had a dip in energy, which is acceptable, but no nausea. So that was really good. I lost appetite, which is great because I've lost 11 kilos. So I'm looking hot and sexy now. So I'm really happy with myself. So it's
That's
an
good.
excellent, it's just about, reframing and telling yourself that for me, cancer was an excellent weight loss management program. Okay. Because everything tastes so metallic, so you don't want to eat, right? And it's also a great, because I think my lifestyle was really like a train wreck. Like I think in Asia we do not know how to pull the handbrakes and we don't know how to say we have to stop and then we need to rest. So this was a great time to pull the handbrakes, and there were a lot of things I couldn't do. That's one symptoms which I had was what we call chemo brain, where I can walk and I'm so forgetful, right? And that's effects of chemo, and you can walk into a room and then I'm supposed to do something, what it is, but it's not that split second, but it's a lot of events. So that was scary. I thought it was an early dementia or something, but these are all effects of chemo. So yeah, just make sure your ecosystem is set up the ecosystem. Yeah, that's all I can say.
Uh, I mean, I do know, like when you say about ecosystem, did it help or for you to speak with other cancer patients that were going through the same? I'm sure when you went for your, treatment, you met other people who were going through the same. Um, did that help, or was that something that was not as helpful?
I remember when I first went for my first chemo, uh, the room, I'm not, it's like cubicles, right?
Mm-hmm.
It felt like I went to a mortuary. Nobody talked, nobody smiled. You know, your body don't lie. You know how you walk, like, you bend it, you don't walk upright and like, So,
Mm-hmm.
and I told myself, no way I'm going to be like this. So, the whole 16, it's really a conscious decision as to how you want to treat this. You can choose, nobody will blame you if you want to behave like, oh, woe unto me. Nobody blame because you do feel like woe unto me. You feel like death every day. But I chose to, in the end, my cubicle was the noisiest and we laugh a lot. I found out who's dating who. I found out the nurses who don't like who. It's just a big people auntie moment. So I really enjoyed myself. So it didn't feel dreadful going for chemo. In fact, I look forward to it. I'm a people person. So, but most of the time, like, my chemo can last up to 5 to 6 hours
Oh,
sometimes. Yeah, it's that long because there are many, many drugs and, so most of the time I'll be sleeping because it does cause drowsiness. It does give you a medicine to cause you to relax and to sleep. So it was a great sleep, I had. And did I find it useful to speak to a cancer patient? Okay, I only knew one other person who
oh,
had cancer, was a good friend, and I won't mention her name, but I am so glad I spoke to her, and I'll never again speak to her because to another cancer patient because two-person going through the same cancer has very different experience. Just like you and I can go to the same movie and we'll come up with different reflections. So for her was because she's a dear friend, she said you cannot eat this, you cannot go out, you cannot mix with people. And I remember last year when I shared my story at Women of Courage Asia 3rd anniversary, I had a big call from her and she screamed at me and scolded me and said, how dare you go, you're going to get COVID and your immune system is zero. So I always have this, I won't mention her name, let's name her Deborah, okay? I told myself, my whole cancer treatment, I never want to be Deborah. So that was my mood. So whenever I feel down, I go, I'm not doing a Deborah. I'm not doing a Deborah. So that was one of my motivations. So I think, yeah, it's now after going through chemo, it's actually very doable. It's not as bad as it sounds. I'm not encouraging people to get cancer, okay? Because it chooses you, okay? You don't
Yes.
choose. It's not like
None
COVID,
of them
okay?
wants to strike that toto, don't worry.
Yeah, I'm very excited at 4D. But what I'm saying is that it is actually the journey is not that bad. It's not that bad. Now looking back,
But I must say, all those people who were in that room every time you are having treatment are probably very, very fortunate because you totally must have lifted their mood and the atmosphere there. I think it makes a lot of difference when
I do
you
not
go
know.
there. I
I do
don't
not
know.
know.
I
Because
definitely would love
people
to have
who
somebody so as positive as you there.
uh, but a lot of time you see people. I mean, I think one of the thing that I'm not going to lie and say that I didn't have my down moments. I had my many down moments where I never questioned God why, but I think one of the got me really down is my appearance is very important to me. I always think I've got a pretty face and my hair is great. When I lost my hair, because the hair was coming down in chunks. So after one first month of treatment, my first treatment was in December. By January, when you lie down on your bed, when I wake up, there's lumps of hair that just drop off. So I made a decision to pay $5, go to Ang Mo Kio, pay $5, and had it shaved off. I think that for me was horrible.
Liberating? No?
Yeah, not
Horrible.
having your hair and then not having your eyebrows will drop. So I really look horrible. I feel that I look really horrible. Like even now, even the hair is growing back a bit, but I've taken photographs of myself and I suppose that for me affected me. So if the side effects didn't get me, the appearance got to me.
Yeah, can understand. I mean, women, hair is our crowning glory. I have thinning hair, so I think I can to some part understand what that means because every time I see bald patches, I'll be like, I'm only like what age and I'm already going bald. How I'm gonna survive the rest of the other years? So yeah, I can understand. We all want to look pretty, whatever age we are. Yeah, but so I don't know. Going through all this thing, it sounds like you had your game together. You kind of like knew very early onset, how you wanted to position yourself to fight this war, to fight this battle. But I guess not everybody can be as strong as you, and I really applaud that you've done it. I mean, I know there's still a couple of months to go, but definitely I know you're gonna make it to the final point, and we're gonna be cheering you there. But now that you are almost there at the final point, on hindsight, is there anything at all that you would have done differently?
Oh, please touch yourself. I know it sounds so rude. Please touch yourself.
At the
Fondle your breast. It is an organ that belongs to you. I mean, I'm a believer, so I always believe that your body is a gift from God, right? So you must take care of it. I mean, I'm not talking about obesity, that's also very questionable, okay? But, breast cancer is something early detection, right? And if you have early detection, if it's like 1 millimeter or 1 cm, it is so treatable and you don't have to go through chemo. You get what I mean? You don't have to go through the craziness. Yeah, it's just a little keyhole surgery. They take it out, they patch it up, 2 hours later they send you home, or 24 hours
Wow.
depending where you are. So it is, so do touch yourself. I know I'm sounding very cute, but do fondle yourself. If you don't want to fondle, ask your husband to fondle you and say, hey, tell your husband, I'm not suggesting anything funky here, but you just like let's have a good time with this. Yeah. You get what I mean? So Yeah, early detection. Go for a mammogram, and it's almost free. If you go during the breast cancer month, right?
Mm.
It's almost free in your polyclinic, and I mean, there's no excuse. There's no excuse, and you don't want to go through what we cancer patient going through. 16 rounds of chemo, surgery, then after that, still have to go through chemo tablets because they still found little mini ones. So, and also take care of your stress level. I think, as I was saying, my life was a train wreck. I was like, woof, 300 kilometers an hour. I think the stress level, my cancer is because of my stress level.
Mm.
I didn't take care of my stress level, and I think maybe I had a lot of pride thinking that I can conquer everything. You know, so yeah, stress level, and yeah, have a good time with your husband. Touch
You're
yourself.
making those people who are not married very envious now, okay? Because they got nobody to do it for them. Well, I mean, of course,
Uh,
we're not advocating anything here, but do get
we're not
yourself
really
checked.
anything bad, but if, well, if you're not married, you can find ways to get somebody to touch you.
Yep. But anyway, so just want to shout out, so what should you be looking out for when you are having, you want to look out for symptoms. So just sharing another infographics, these early diagnoses would consist of nipple changes, changes in your breast color, bloody discharge, pitting of the breast skin. So a bit like, like a bit like what do you call it? Rotten apple when they start to have some wrinkly stuff, yeah. You have a lump in the breast or maybe even breast or nipple pain. So these are just some of the things that you need to look out for apart from just finding that lump. So, a lot of us, when we do the check, we always think, oh, it must be a lump, but there are other symptoms that you can also look out for. So these are really good tips that I hope that you can take away as well. And before we go for the day, I have one more thing to shout out for. All this is not just to it's not just to get you to know all this knowledge for nothing, but we really really want you to go out and grab a girlfriend to get them to go for to go for a breast scan or ultrasound or mammogram together. I think that's the most important thing that you can do for a loved one this month. Okay, so really go and grab a girlfriend if you're a female, or if you're a husband, get your wife to go for ultrasound, breast ultrasound, or go for a mammogram, and then you will be doing them lots of good. Yeah, so we do have for this month also in leading up to the end of the month, we are doing a little exploration race. So we are doing in the name of breast cancer awareness. We're gonna have amazing race again. Anita, you can be back then. Will you be back by then? Yes? Okay, you got to
Yes, I'll
join
be
us.
back by then, but super jet lag.
Yay!
But sure, why not? I
Bring your
just walk for you.
yeah. Okay, or you can be our station master so you don't walk so much, okay? Yeah, but get your girls to come and join us, get them to bring their friends along. I'm bringing my intern. So yeah, it's gonna be fun, now that borders are open, no more COVID measures. We are gonna be having fun time running across Singapore, learning interesting facts about, breast cancer awareness stuff, debunking the myths of breast cancer and lots more. Okay. So, and if you don't already know, I'm going to just do shout out for one more thing. For Breast Cancer Foundation, they always have a memo bus going around Singapore every month. And if you need to get yourself checked and you don't want to go to like a clinic and whatever, do go to their website and check out when's the next memo bus coming near to your neighborhood and go sign up. All right. We don't have a lot of time today, but I would really, really love to have a chance to chit chat with Anita more. But Anita, before I let you go, I know we've been shouting out again and again and again, but is there any other thing or one last thing that you want to say to our viewers?
um, Self-examination. That's it. Honestly, if you forget anything I say, don't worry about your mindset and all that. Get your mammogram done once every 2 years. That's all.
Once every 2 years at least, right? Yeah,
Minimum.
minimum. All right. So I want to say thanks so much to Anita for really even sparing us the time while she's away in UK to come and do this sharing with us. But we are so looking forward to have you back, Anita. And ladies, we'll see you in the next episode of this breast cancer awareness series, and we'll be having Teresa Tan to come and share with us her story. So let's see you next time. Thank you so much. See you.